I think a lot of people have some trepidation, or at least they don't understand how the whole system works when they go see a surgeon. In fact, there's been a few studies that kind of show that the minute a physician mentions surgery, I think the rest of the appointment goes out the frontal lobe. It kind of gets gobbled up by other parts of the brain because the fear takes over. So I guess understanding how the workflow of the whole system goes is important. And the goal of the initial consultation is to hopefully identify the problem. Doesn't always occur, but usually we can figure out what the problem is. And that usually involves bringing in pretty much every study you've ever had done on your hip. Sometimes we'll request recent ones. Typically within 3 months is sort of when we start to see differences between x-rays. So it's good to get new x-rays. If they haven't been done within 3 months, it's probably a good idea to get some, but not required, but generally it's encouraged. Assembling all that information, then you bring it in, and that visit is pretty informal. We're going to talk about the history of the hip problem. We're going to talk about medical conditions which may be coexistent, and talk about kind of how they may be influencing or not influencing this problem. We'll want to know duration, timing, severity, what things we've used that have helped, things that we haven't, tried or we'd be willing to try. So we're going to explore all those things, and then we'll review the imaging. We'll do a physical exam, which is generally comprehensive, involving range of motion, strength, neurologic testing, vascular testing. So we'll get through the physical exam, and then based on the imaging and the exam, usually that's enough for us to at least get a preliminary idea of what we call a differential diagnosis. Differential diagnosis means the various possibilities of what we're dealing with. And usually we narrow it down to 1 or 2, sometimes 3 or 4, but we kind of narrow down to what we're doing. And then we can either recommend additional testing to identify, what next step, or we come up with a treatment plan. And that initial consultation kind of gets you to that point. And that gives us at least a direction we're going to go throughout the rest of our care. Now, at that visit, we may decide fairly straightforward problem. We're dealing with hip osteoarthritis. Okay, well then our next step is to propose treatment, and treatment can be surgical or it can be not surgical. If somebody hasn't really tried much in the non-surgical realm, we might advise that we try certain steps in the non-surgical realm. And if we've tried those in the past and they haven't worked, or you want to try something different, that's your decision, but I will at least have to offer you that. And then there's the surgical side, and the surgical side generally is when I hand the chart over to my teammates, and my teammates in my practice are my scheduler, my surgery scheduler. She'll help with getting scheduling and authorization, making sure that we're doing this in a cost-effective manner for you. And then there will be the surgical care coordinator who's going to go through and make sure that we're doing everything as safe as possible for you so that we mitigate some of the risks that we can encounter during surgery. So that's where that transition occurs. Generally, we will see you one more time if we are planning surgery, one more time prior to proceeding with surgery, where we will review any additional questions or concerns that might have come up. We will review any concerns that might have come up through the pre-surgical testing period, and we'll come up with the game plan for the day of surgery. The very next visit is basically a surgical visit, and then we're into what we call follow-up care. And follow-up care after the surgical visit can be sometimes in a hospital, sometimes in a surgery center environment, but the follow-up care is generally done as an outpatient through our clinic. We kind of manage everything for 90 days thereafter under the follow-up care umbrella, and that's where we're going to kind of take over and just manage everything until we get to about a period of where we are stable in your recovery.